The views and opinions expressed by the following program and its participants are solely their current opinions and do not reflect the opinions of Bobo 89.1 FM and DMS Broadcasting respective stations. The program participants' opinions are based upon information they consider reliable and based on their knowledge.
Welcome everyone to Your Health, Your Wealth, brought to you by BAF Insurance. Your Health, Your Wealth airs every Wednesday from 6:30 to 7:30 a.m. So remember to tune in each week and tell a friend. You can also catch the shows you missed on YouTube on the Be Well, Be Healthy for Life channel.
And make sure you tune into the show and listen in for our resident superstar, Lady K.
If you don't know who Lady K is, her podcast, Be Well, Be Healthy for Life, is sponsored by BAF Global Group and can be found on YouTube. Her episodes are released weekly on the BAF Facebook page as well. Your Health, Your Wealth is brought to you by BAF Insurance as a community service. Your Health, Your Wealth airs every Wednesday from 6:30 to 7:30 a.m.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
There's nothing more important than your health. BAF Insurance knows that. It's why we offer quality, affordable healthcare plans for both groups and individuals. It's why we have created the Be Well, Be Healthy for Life YouTube channel and the Your Health, Your Wealth radio show. At BAF, your health is our priority. Visit us at bafkman.com, follow us on Facebook, or give us a call today at 949-5089.
Once again, folks, thank you so much for tuning in to Your Health, Your Wealth each and every Wednesday morning at 6:30 a.m. We get started here. Remember, it's 6:30 to 7:30 a.m. Thank you so much for tuning in. We hope that you had a safe start of the week. For the next hour, we will be sharing health tips and chatting with our special guest. And you know, Des, each and every time we get together, we have to thank our friends over there at BAF Insurance.
Yes, we do. Because Your Health, Your Wealth is brought to you by BAF Insurance. Your Health, Your Wealth airs every Wednesday from 6:30 to 7:30 a.m. right here on 89.1 FM, Bobo Radio. So remember to tune in each week and tell a friend. You can also catch the shows you missed on YouTube on the Be Well, Be Healthy for Life channel. So don't forget to like, subscribe, and share.
And with that being said, let's get on in and start talking about our special guest.
Yes. Today, we will be conversing with Dr. Asbun. Dr. Asbun is a board-certified hepatobiliary, pancreas, and foregut surgeon at Baptist Health Miami Cancer Institute. Dr. Asbun offers a unique perspective in the realm of medical expertise. His specialized focus lies in minimally invasive surgical procedures specifically designed to address liver, pancreatic, and upper gastrointestinal diseases. Notably, Dr. Asbun boasts extensive experience and a strong interest in the field of surgical simulation. This sets him apart as a forward-thinking medical professional. He's very keen to engage in interviews that delve into the recent advances in pancreatic surgery. He will be able to shed light on how Baptist Health Miami Cancer Institute has harnessed these breakthroughs for the benefit of patients. Additionally, he can provide valuable insights into the risk factors associated with pancreatic cancer, an area of critical concern in healthcare today. Dr. Asbun's expertise and dedication has made him an ideal candidate for discussions in cutting-edge medical advancements and their tangible impact on patient care. For a comprehensive understanding of advancements in pancreatic surgery and cancer prevention. Well, good morning, Dr. Asbun. How are you?
Good morning. Good. How are you?
Great. And thank you for being on the show. Thank you for taking the time out and arranging to move things around on your busy schedule, I'm sure, to get to have this sit down with us.
It is a pleasure.
It's a pleasure. Thank you.
So getting started, your certification is as long as my arm, and I'm 6'4". So give me the understanding so our listeners can hear the dedication, because this is not something that I normally say, but forward thinking in medical is kind of the new norm And I said, you are definitely on the floor. So tell me a little bit about your background and history and how you got into this.
I really appreciate that for your kind words. Thank you. So I am a hepatobiliary and pancreatic surgeon and a foregut surgeon primarily. That's the kind of, I'm starting with the end. My name is Dominic Asbun, as you mentioned, and I work at Miami Cancer Institute, Baptist Health in South Florida in Miami in the United States. Basically, to get to where I'm at now, you obviously, after you go through medical school, etc., you choose to go into a career in surgery. So I do a general surgery residency, and throughout that time, I realized that I was falling in love with a certain part of the abdomen, being the liver and the pancreas, and kind of the upper gastrointestinal tract. And so I decided to seek further training in that. Now, at the same time, I realized that these operations are very complex, and there are a lot of places, very, very well-renowned places, that are still doing most of these operations in an open fashion. And I say open as opposed to minimally invasive or laparoscopic and robotic, because one of the big changes that we've seen in surgery, we'll talk about this more later, I'm sure, is the advent of laparoscopic surgery or minimally invasive surgery, which is, instead of doing a long single incision, you do a handful of smaller incisions, and through those you place surgical instruments. One of them is a camera, so you can actually see, and the other one are the instruments you use to operate. And so, as you can imagine, it's a lot harder to operate that way, because you're not holding things in your hand, you're holding them with it's almost like eating with your hands versus eating with chopsticks, if that makes any sense.
It does.
And so it takes kind of an advanced training, specialized training, to be able to do these more complex procedures in a laparoscopic fashion. Robotic surgery, which I mentioned, is sort of similar, very similar. It's just a slightly different tool, but it's also minimally invasive surgery. So I sought out training that offered kind of the best of both worlds, both a lot of exposure to liver and pancreas surgery and surgery of the upper gastrointestinal tract, but also had some amazing surgeons that were kind of the leaders in their field in these minimally invasive techniques. And so I did a fellowship, which is extra specialization at Mayo Clinic in Florida. Had some great mentors there, and that kind of gave me the tools that I needed to get to where I want to be. And my career development, my learning has continued even after my training, because I decided to work with a very well-known, very well-respected surgeon here in Miami, who actually happens to be my father also. His name is Horatio Asbun. He is a pioneer in many ways in these pancreatic and liver procedures in a minimally invasive way. He's been very successful. He's also a great guy. And so I decided to be able to work with him, not just for the joy of working with my father, but also so I could continue to learn and get more tricks under my belt. And so I'm very, very fortunate to have had the training that I've had, and the exposure that I've had, and the support, even ongoing support, that I have now for these more complex procedures, because it's hard. It's not easy, but it's definitely a beautiful career.
Exactly. And so for anyone who's just tuning in, and if you have had pancreatic cancer or know someone with that, you kind of have an idea what we're talking about. But break down what exactly is pancreatic cancer to someone who may not be aware of it, or just listening in and hearing the program. I read that there are two main types of pancreatic cancer, but kind of give me an elaboration on that, doctor.
Of course. So I'll take a step back, and I like to ask my patients to think about what is cancer in general. Because when we think of cancer, we have this idea that something is invading our body, that something exterior is coming into our body the way a virus or a bacteria would. But that's not really what cancer is. Cancer starts from within our own body. So our body physically is nothing but billions of little cells, right? These small little microscopic cells, and the cells have different jobs. So you have some cells that are skin cells, you have some cells that are bone cells, muscle cells, pancreas cells. And even within these organs, talking about the pancreas, there are multiple different types of cells that make up the pancreas. The pancreas itself is an important organ because it makes hormones. So it makes insulin, it makes other hormones that help with your digestion and metabolism. And it also makes enzymes, which are basically chemicals that get put into your intestine to help break down the food. So the hormones go into the blood to affect, digestion and metabolism. and the enzymes go into your intestines to mix with the food and help break down the food. And so you have different cells that produce all of these, and the enzymes, when they get placed into the intestine through a tube or a duct, a pancreatic duct. I'll elaborate on this more, but it's relevant to what we're talking about. So a cancer is when a cell, one of these cells gets strange, and it starts making too many copies of itself. Now, cells can make copies. Most cells in our bodies can make a copy of themselves as needed, and they do. When you cut your skin, the reason your skin heals is because the skin cells make copies, and they make more skin. And when the skin is closed, they get a signal to tell them, look, stop making a copy. We've already closed our defect. A cancer cell is a cell that gets strange and mutated, as we say, and it starts making too many copies and doesn't stop. I say it's sort of like a zombie cell that will not make will not stop making copies. So one zombie cell becomes two become four become eight, etc. And they keep making more and more copies of themselves. And when you have literally millions of these cells, it's finally kind of a ball of cells that you can see. That's what we call a tumor. You can see it on a CT scan or in, if you're holding it in your hand. When it's just one or two cells, they're microscopic, so you can't see them at all unless you happen to catch it and look at it under a microscope. And so the types of cancers that we see are based on the types of cells that became zombies, so to speak. And in the pancreas, the most common type of cell that gets strange like this is the cell that makes that duct, that tube that carries the juices, the enzymes into the intestine. Those ductal cells turn into a type of cancer called adenocarcinoma. And so you'll hear the term pancreatic ductal adenocarcinoma. That's a long word, but basically it's saying that the cells that line that tube are weird. They start making too many copies, and those are the ones that grow. Now, there are other cells in the pancreas that can become a little strange. Those other cells that make the hormones that I mentioned, they can also become a little strange and grow, and those tend to be the ones that we call the pancreatic neuroendocrine tumors, or PNET, which is sort of like a general term because there's different cells for the types of hormones they make. But generally speaking, PNETs are another type of pancreas tumor that we see. And then there are, a handful of other things that can grow in the pancreas that might not be cancers per se, but that are also due to some abnormality in the cells that are there. So generally speaking, we oftentimes divide two of the more common types of pancreas cancer into either the exocrine cancers, which are the ones that make the juices that go into the intestine, so the pancreatic ductal adenocarcinomas, and the endocrine cancer, we call them the pancreatic neuroendocrine tumors, PNETs. And there are other types of cancers that are not as common, but those are the two main groups that we see in the pancreas.
So those are tumors that begin making the cells into the digestive enzymes type of stuff, in basically taking care of your stomach and all the digestive. Would I be correct in saying that, Doc?
In a way, so the stomach per se is a part of the tract. So when and you guys probably understand this, when you eat, the food goes down your esophagus, that's like a tube, into your stomach, that's like a bag, and then it goes into your intestine. That's another very, very long tube. It's basically like plumbing. The food is going down this plumbing, and the pancreas is plugged into the first part of the intestine, what we call the duodenum. It's plugged into it. And so as food passes through that first part of the intestine, the food leaves the stomach into the first part of the intestine, the pancreas is plugged into it, and it dumps those juices into there. And yes, exactly as you were saying, the cells that make the tube of the pancreas, the duct of the pancreas, are the ones that go wrong, basically.
Wow.
Okay, so doctor, what are some symptoms that a person with the neuroendocrine tumors, what kind of symptoms would they display?
Good question. Now, very, very commonly, they don't show any symptoms at all. And this will be true for any type of pancreatic cancer. A lot of times the pancreas is tucked away behind a lot of other organs. There are not a lot of nerves around it. And so a lot of times patients will not have symptoms until it's grown, which is part of the reason they're difficult. Now, neuroendocrine tumors tend not to be so aggressive. And not as dangerous usually. And so usually they're found incidentally, meaning someone gets a CAT scan because, I don't know, they were in a car accident or they're having some other type of belly pain, and then they find this tumor. Usually doesn't cause symptoms. Sometimes if the neuroendocrine tumor, because remember it's from the cells that make hormones, if those cells are actually making extra hormones, then they will have symptoms that go directly to the type of hormone they're making.
Okay.
Yeah, you guys will all fall asleep if I get into the details.
No, but just give us one. No, just give us one example.
So one example is you have to know the type of hormone, and for example, insulin. It lowers your blood sugar, right? It makes the blood leave the sugar. The sugar leave the blood. So people with a neuroendocrine tumor producing insulin, what we call an insulinoma, will have very low blood sugar and will have symptoms from it. So let's say they might faint. They may feel lightheaded. They will, if they have their blood sugar checked, they'll notice that it's particularly low. And so they might feel better when they take in sugar. If they're having these symptoms of feeling lightheaded and can't concentrate, and all of a sudden they eat something and they feel completely normal, that might be a symptom of it. Now, I want to say that for all of these tumors, even the pancreatic ductal adenocarcinoma, they're very rare, all things considered. And so most people that feel lightheaded every now and then don't have an insulinoma.
Okay.
And I don't want your listeners, if they feel a little bit of abdominal discomfort or a little bit of dizziness, I don't want them to think, oh my gosh, I have pancreas cancer, because most likely it's not the case, but those are the symptoms.
Okay, excellent. Well, folks, we're talking here all the way from Miami. Dr. Asbun, he is representative, one of the foregoing surgeons over there at Baptist Health Baptist Health Miami Cancer Institute. We're going to take a quick break and come right back. And I'm going to ask what are some of the treatments, so we can kind of, we've been talking about what it is. Now let's change it and kind of talk about some of the treatment. So we'll take a quick 2-minute break and come right back.
Okay.
Your health, your wealth, your health, your wealth, your health for life.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Today on Be Well, Be Healthy for Life, Lady K, your wellness coach, talks about breast cancer awareness.
It's that time of year again when we turn our attention to breast cancer awareness. This episode is not only for ladies. It's important to note that 1 in 100 cases of breast cancer happens in men. The signs and symptoms for both men and women are similar, so getting tested is important for all genders. And now is a good time to subscribe to the channel if you haven't done so. Hit the notification bell also so you know when we have new episodes that have been uploaded. The most common symptoms include a lump or swelling in the breast or underarm, redness or flaky skin in the nipple area of the breast, discharge of fluid including blood from the nipple, changes in the shape or the size of the breast, including the nipple, and irritation or dimpling of the skin around the breast. It's important to note that many women who find out they have breast cancer do so unwittingly. They never feel a lump or have any other sign or symptom, and simply discover that there is some suspicious tissue during a routine mammogram. Some of these symptoms can happen in other conditions. For example, many women have a non-life-threatening condition known as fibrocystic breasts, which causes their breasts to be lumpy. Cysts can also cause lumps in the breast, so don't jump to your own conclusions regarding any symptoms. Instead, take them seriously and see your doctor. There are many factors that can put one at risk for having breast cancer. Breast cancer risk increases with age, obesity, and heavy alcohol use. Women over the age of 50 and men over 70 have a higher risk of developing the disease. Women with a history of breast or ovarian cancer in their families, have dense breasts, started their menstrual periods before 12, or have had breast cancer before are at higher risk. Men who have liver disease or certain testicular conditions, or who have had estrogen treatments for prostate cancer are also at higher risk for breast cancer. Because men typically have less breast tissue in general, lumps in male breasts are often easier to detect by touch. There are no proven foolproof ways to prevent breast cancer, but a healthy lifestyle that includes regular exercise, a healthy weight, and a balanced diet that includes natural, whole, and organic foods is a good start to lowering your risk of developing cancer and improving your chances of surviving cancer if it occurs. Mothers who breastfeed also lower their risk of developing breast cancer. Self-examination on a regular basis is vital. Everyone should be familiar with how your own breast is shaped and how it feels to touch. This is important in spotting irregularities and changes such as a lump or inverted nipple immediately. There are a host of videos and other resources online that can guide you through the correct way to do a self-examination or have your partner assist. I must stress, however, that self-examination should not be used to replace regular mammograms and doctor screenings. A self-examination is just another tool you have in your arsenal to help you detect breast cancer at the earliest possible time for the best possible outcome. It's important to get screened and know your status. Screenings include yearly mammograms for women after age 40 and possible testing for inherited genetic mutations in certain genes. If you have a family history of breast cancer, it may be a good idea to get screened for the breast cancer 1 and 2 genes to determine your risk of developing the disease. Men, this goes for you too. If you are at high risk because of family history, have the conversation with your doctor and get tested. Early detection saves lives.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.
Hi, mi nombre es Zulma y yo hablo español. If you are looking for a group health plan that fits your budget and need, then I'm inviting you to take a look at BAF. Our plans are flexible and affordable. So whether your group is large, medium-sized, or small, we will work with you to design the plan that is right for you. If you have already taken a look at BAF, then it is time to take a second look at our company that has perfected the art to design health insurance plan. Give me a call directly at 814-2532 or call our office at 949-5089. I am ready and waiting to help you find the plan that fits your needs. Give me a call.
If you want coverage for life, choose BAF, they'll get it right. Yes, that's the best choice. BAF, that's BAF for life.
That's a fast 2 minutes. Okay. And we're back. You're tuned into Your Health, Your Wealth right here. Compliments of our friends over there at BAF Insurance. Each and every Wednesday at 6:30 a.m., we get together and talk about all things related to your health for the next hour. We thank you for tuning in. And we have with us all the way from Miami talking to us about pancreatic cancer. And Doc, I know I'm going to mess up the word. You're a board certified.
Hepatobiliary.
Hepatobiliary. How do you pronounce that, Doc?
The word is hepatopancreatobiliary, but we can just say HP as in Peter, B as in boy.
Okay.
HPB.
HPB. I know. HPB. I know I was going to mess that up, but let's
make it long on purpose to make ourselves sound fancy.
Doc, you have such a great heart. I appreciate that. And the great thing about this, folks, is that we want to bring you as much information as we can. So some of it may sound a little bit technical, but I guarantee you, for anybody's out there who's listening, who has had a family member themselves walking through this path, this is great information. He's on the cutting edge of
all the latest.
Yes, and I say in a science that traditionally has been kind of old school. Would you say that, Doc? And now we're kind of moving forward into the realms of robotic, getting people with evasiveness, because for years and years, one of the things I always tell people is, and especially, and I love my West Indian people and my Spanish people, but when you say doctor and you say you're going to get cut, so when you say evasive surgery, minimally, yeah, it makes it more understandable to them, and they're more willing to say yes quicker and find out the more information rather than clamming up. So
Right.
that's what. Would you say that, hey, Doc? You know more about this than me.
No, I absolutely would, and it's minimally invasive is like you're saying, it's very descriptive, right? Now, I'll tell you, pancreas surgery, as you mentioned, is still very, in some ways, kind of old school, even though we're making big advances. But it's because it's so difficult, and there are a lot of very good surgeons that still do all of these procedures open, and even I myself do a good number of them open if there are increased number of difficulties.
Mm-hmm.
I can't pretend to tell you that every single Whipple, for example, which is a big pancreas surgery, should be done laparoscopically because there are some patients where you have to do it open. And so the important thing is getting a surgeon with experience that does a lot of volume. And if you're able to then on top of that offer it minimally invasive, it's even better, and that's how, as surgeons, we're pushing this forward, is by making the surgery less stressful on the patient's body, less impacting because they're smaller cuts.
Exactly. And the great thing about that, Des, is that you have the option. It's all about knowing and having a doctor who is able to give you those options and talk about it. And that way you can decide what works best for you as the patient and also the doctor as well. So, so Doc, before we took the break, we talked about some treatment options, and you started alluding to that. Tell me some of the treatment options and are there any new developments and things of that nature?
Right. So the first question is, what is it that we're treating? So if we're talking about pancreatic neuroendocrine tumors, believe it or not, if they're small enough and they're not causing symptoms, mean they're not making extra hormones, sometimes we will just observe them if they are small enough, because we know these can be very slow growing. Okay. If they're bigger or if they are causing symptoms, then the main treatment is surgery. And surgery can be sometimes not as extensive as it would be for the other cancers. Even a lot of times people, when they say pancreas cancer, they're really talking about the other type of cancer, the ductal adenocarcinoma. And they refer to PNETs, to the neuroendocrine tumors, as not necessarily as cancer, even though they both are kind of along the same lines of cells making too many copies of themselves. If we ask what is the treatment for pancreatic ductal adenocarcinoma, then we get into the realm of more intensive treatments. Now, surgery is still the definitive way of curing someone of cancer. We have a lot of other things that help patients, but surgery really is kind of the best way to cure them. That being said, pancreatic adenocarcinoma is a type of cancer that spreads early and spreads frequently, meaning the cells will break off of where they are and start traveling to other parts of the body. And you can't cut out those cells because you don't know where they are. And so chemotherapy is one of the most important adjunct therapies that we do to give pancreatic cancer patients. The majority of patients will get chemotherapy if they're going to, along with surgery, if you want to fully treat cancer of the pancreas. And if you cannot operate on them, they will oftentimes still get chemotherapy because it can have pretty surprising results and shrink the tumor. Now, the advances we've made are in the types of chemotherapy that we give, the dosage, the combination of chemotherapy agents, and also other agents that might be more based on kind of stimulating your immune system, et cetera, and molecular changes, the details in how the small individual cancer cell has genetic mutations. Is there a medication that treats that specific genetic mutation? Now, we have not seen as many advances, I would say, in pancreas cancer as we have in other types of cancer along these lines of, for example, immunotherapy, but it's definitely in the works, and it's at the forefront of what we are trying to do. There are also other ways of treating the cancer with something like radiation. So we, for example, here at Miami Cancer Institute, we have a very, very sort of avant-garde, cutting-edge type of radiation that we give that's not available in many places in the world, that gives a very high dose of radiation using a special machine. And we are now using that for pancreas cancer patients because we're able to give a high dose of this radiation that burns the cancer, and they can have some very, very good results. It's usually not considered curative, but it has some surprisingly good results. So we definitely keep it as one of our weapons against cancer.
Dr. Asbun, when someone is diagnosed with pancreatic cancer, or at least when you as a friend or a family member, you hear about it, it sounds so scary. What is the life expectancy is it dependent on the stage or is dependent on the patient's response to the treatment?
It's a good question. It's definitely a little of both. The first thing I will tell you is if a patient ever goes to a doctor and the doctor tells them, I promise you have 3 months to live or 1 year to live, that doctor does not know what they're talking about. They don't keep their promise, because the reality of it is none of us have a crystal ball. We have a general idea of how a cancer will respond and how much. If you look at, these studies have looked at thousands of patients. We have a general idea, but we don't know for sure. So the first question is, there's always variations, and sometimes patients do much better and sometimes they do much worse. But generally speaking, we can guess how roughly how long someone will live based on their stage. Now, the stage, there's different ways of staging it, but it basically has to do with how extensive that tumor is. Is it just one small tumor in one location, or is it bigger? Is it involving important blood vessels in the area, which is, for pancreas cancer in particular, is very important to us, what blood vessels are involved. And has it spread somewhere else, aka has it metastasized? Once it has spread, obviously the prognosis is markedly worse. And if it is involving blood vessels, sometimes that means we cannot actually operate on it, even if it hasn't spread. So if we were to generalize this, if we were to generalize this into three categories. One that we would call localized, where it's very, very local, it's small, it's not invading any major blood vessels. You can say that the 5-year survival rate, meaning the number of patients that are likely to survive with treatment 5 years, would be anywhere from maybe 35 to 45%, depending on the studies that you look at.
Okay.
And again, this is a big generalization. Everyone's different. But if it's local regional, so meaning it is starting to spread to local blood vessels or to other things, and we might not be able to operate on it, the 5-year survival drops to about 15% with treatment. And if it is distant, meaning there's metastasis, the 5-year survival is at about 3%, meaning that if you took 100 patients with metastatic pancreas cancer, only 3% of them with treatment are expected to be alive in 5 years. Now, as you can tell, they're not good numbers. Pancreas cancer, and we're talking about pancreatic ductal adenocarcinoma, is an aggressive tumor, and we don't have great prognosis for it, which is why we're trying to do everything possible to increase those numbers.
Okay, can you tell us a little bit about the risk factors, perhaps, that lend to persons developing pancreatic cancers? Is it really, are there like risk factors involved in it, or is it like just genetics, or what is it?
Yes, so there's like everything, there's a little bit of everything. Now, some people just get pancreas cancer with no known risk factors, and we don't know why, and it just happens, and it's very unfortunate, but it happens. There are certain risk factors that we clearly know increase the risk of pancreatic cancer. Now, probably the most obvious one is tobacco use. Cigarette smoking and other uses of tobacco are very clearly linked to increased risk of pancreatic cancer, as well as other things. And the reason is because, we talked about cells becoming strange and zombie cells. Well, the use of nicotine products will cause changes in those cells. It will make them go from a normal cell to an abnormal cell, and then it can turn into a cancer cell. Other risk factors, more and more we're seeing an association with obesity, possibly with type 2 diabetes, even though the data isn't as clear, but obesity has been linked to pancreas cancer, in part because it causes kind of a low degree of ongoing inflammation, fatty changes of the liver, of the pancreas and the liver, but the pancreas, and it causes, little by little, the thought is that it causes damage to these cells that can turn them into cancer. Having a relative with pancreas cancer is a known risk factor. So if you have a first-degree relative, meaning a brother, a sister, a mother, etc., that can be a risk factor. Having a history of pancreatitis, which is an inflammation of the pancreas, especially multiple bouts of pancreatitis, can be a risk factor. So smoking can cause pancreatitis. Drinking is one of the most common causes of pancreatitis. Those things can lead to cancer, etc. And then there are known genetic mutations. There's some genetic mutations that are carried in families, such as the BRCA gene, BRCA, which is associated with breast cancer, that is also associated with an increased risk of pancreas cancer.
Okay. In closing, what would your advice be to someone who's experiencing some symptoms, hopefully not all symptoms that you just spoke about? And what is the importance of seeking medical attention or medical advice as soon as possible? And I'm sorry for asking so many questions in one, but for in the time, what kind of tests should you expect that's going to be done? Is it like blood work or is it scans? What kind of tests are done?
All very good questions. So I will reiterate what I said earlier, that not everybody with these symptoms has pancreas cancer. And actually the symptoms of pancreas cancer, most of them are seen in other conditions that are not as serious. So vague abdominal pain is one of the symptoms you might see. The more concerning symptoms are people looking yellow. And it's because you get a blockage of the bile duct coming from the liver that goes to the pancreas. If that gets blocked by a tumor in the pancreas, people will look yellow or jaundiced. And especially if it's jaundice without any pain, that's sometimes what we call painless jaundice, is associated possibly with pancreas cancer. Weight loss, uncontrolled weight loss with no reason can be one of the symptoms. If you have one of the other types of cancers, or of the tumors like neuroendocrine tumors, it would be related to the individual hormones, etc. If anyone is having any of these symptoms, obviously it's important to see a physician, especially if it's something where one day they wake up and they're fully yellow, or they notice they've been losing a lot of weight, or they can't eat and they don't know why, they keep vomiting every time they eat. It's worth being seen sooner rather than later. The workup will depend on the symptoms. A lot of times patients will get a CAT scan, a CT scan of the abdomen. Sometimes they'll get an MRI if it's available. They will have blood work drawn, especially if they look yellow, to prove that there's a high level of bilirubin, which is what makes it yellow. And so it's a combination of lab work and usually CT scans. Sometimes an ultrasound can pick up on it, but it doesn't have the same sensitivity as a CAT scan or an MRI.
Okay. It was really great talking to you. So in closing, we want to thank you again for being here with us, Dr. Dominic Asbun from the Miami Cancer Institute, the Baptist Health Miami Cancer Institute. And we look forward to hopefully having some more discussions with you.
Absolutely. It has been a pleasure, and thank you very much for inviting me.
Thank you. Right now, we're going to take a break and we're going to listen to some health information from Lady K, our health and wellness coach.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Today on Be Well, Be Healthy for Life, Lady K, your wellness coach, talks about anemia.
Growing up, I've always heard that if you find yourself or you see a child eating ice, then they must be suffering from anemia. Anemia has always been associated with a deficiency of iron in the body. But there is more to anemia than simply needing iron. Red blood cells are important for carrying iron-rich proteins called hemoglobin, which also deliver oxygen to your body. Being anemic means that your body has a low number of healthy red blood cells, resulting in iron deficiency that makes you feel tired and weak. There is more than one type of anemia, each with its own cause, and anemia can be mild or severe, as well as temporary or long-lasting. Anemia can also be a sign of a more serious illness lurking below the surface. Depending on the type of anemia, people suffering from it often get cold easily and may have cold hands and feet, experience lightheadedness, shortness of breath, and look pale. As I mentioned before, there are several types of anemia. Iron deficiency anemia is the most common form, and as the name suggests, it's caused by a shortage of iron in your body. Heavy bleeding, such as menstrual bleeding, frequent use of painkillers, and stomach intestinal ulcers or cancers are frequently the cause of iron deficiency. Iron supplements are usually prescribed to address iron deficiency anemia. Care must be taken to increase fiber intake with these supplements, as an unwanted side effect is constipation. Vitamin deficiency anemia, also known as pernicious anemia, is caused by a lack of vitamin B12, a vitamin which is also essential to the production of healthy red blood cells. Some people do not consume enough B12, while others consume enough but aren't able to absorb enough to prevent deficiency. Vegans must supplement with B12 as it's only found in animal sources. Inflammatory diseases can interfere with the production of red blood cells, causing aplastic anemia, while bone marrow diseases such as leukemia affect blood production in the bone marrow, leading to anemia. Certain diseases cause red blood cells to be destroyed faster than they're produced, causing hemolytic anemia. This type of anemia can be inherited or developed later in life. Sickle cell anemia is a serious and painful hemolytic anemia in which the red blood cells are abnormally shaped like a sickle. These sickle-shaped blood cells die quickly, carrying little oxygen, and can sometimes become trapped in blood vessels, resulting in severe pain known as crisis and ongoing shortage of red blood cells. Left undiagnosed and untreated, anemia can cause a host of health issues, from extreme fatigue to pregnancy difficulties, heart problems, and life-threatening complications. The best way to prevent anemia is to eat iron-rich foods such as beans, dark green leafy vegetables, dried fruit, and occasionally meats such as beef. Folate and its synthetic form, folic acid, can be found in dark green leafy vegetables, dark red kidney beans, fruits and fruit juices, as well as enriched grain-based products such as bread, cereal, pasta, and rice. Read labels and look for food rich in vitamin B12 and include foods rich in vitamin C when taking B12, as vitamin C helps your body to better absorb iron. Of course, multivitamins may be necessary to supplement your intake of these vital nutrients. You should definitely have that conversation with your medical practitioner.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.
Good morning again, and in case you're just joining us, you're tuned in to Your Health, Your Wealth, brought to you by BAF Insurance, right here on Bobo 89.1 FM, every Wednesday morning from 6:30 a.m. to 7:30 a.m.
Your health, your wealth, your health, your wealth, your health for life.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, or priority.
Welcome, Mike, to Your Health, Your Wealth. Tell me about BAF Insurance Cayman.
BAF Cayman is a proud member of the BAF Global Group, comprising insurance companies that have been serving the needs of our Caribbean generations since actually 1920. Our company has been active in the Cayman Islands since 2009, and our business continues to grow year over year, supported by our loyal and diverse client base that values market-leading rates, simple but extensive plan designs, and access to the best medical facilities when they need it most, whether at home or overseas.
Is BAF licensed and registered?
BAF is licensed by the Cayman Islands Monetary Authority as an A-class insurance company and specifically approved to provide health insurance by the Health Insurance Commission.
If you could choose one thing that makes BAF stand out from the other insurance companies, what would that one thing be?
Although BAF offers many advantages over other insurance companies, whether you are an individual member or a member of your company's health insurance group, choosing BAF means putting your confidence in BAF to provide the highest quality health insurance plans with the lightest impact on your pockets. And we offer member support services that meet and exceed all your requirements. Our member services provided by our local Cayman-based team are always accessible to support you from submitting your applications or daily member claims to billing queries. You can always count on one of our team members to assist you.
Okay, Mr. Mike, getting close to the end of our 3 minutes. In wrapping up, are your group plans only for companies? And how many people do I need to make a group?
BAF Insurance offers both individual and group plans. Our group plans require a minimum of 5 employees and base rates starting as low as 150 CI dollars. The additional plans that require 5 employees or more is what we refer to as the BAF MedSafe Cayman Health Plus and the BAF Value Plan Enhanced 250, and the BAF Prestige Plan, or most robust plan, requires a minimum of 10 employees to form a group.
How can I get in contact with the company?
Very easy. You can just contact our individual agents, or 949-5089 is our main office line to our receptionist, who would then transfer you to one of our sales agents. BAF website is accessible at www.mybafsolutions.com.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
I am Desiree, co-host of Your Health, Your Wealth. I'll be with you every Wednesday from 6:30 to 7:30 a.m. Saturday, November the 11th, on the public beach, 7 Mile Beach. There's going to be something called Dance for Diabetes. BAF is putting that on.
Okay.
It's going to be from 6:30 in the morning until 8:30 in the morning. You can go on the BAFCayman.com website and register there. So it's going to start at 6:30. I'm sure it's going to be a whole lot of fun, because whatever BAF puts on, it's always a whole lot of fun. And they're going to have like a warm-up with FN Sports. They're going to have Zumba with the School of Fitness. They're going to have health checks by Total Health Limited. And they're also going to have body scans that are available from Essential Living. So the main sponsor is BAF, but it's also Total Health, School of Fitness, FN Sports, and Essential Living. And that is going to be like a whole lot of fun. It gives you something to do between 6:30 and 8:30 in the morning. I mean, I'll keep you up to date if there's going to be any breakfast afterwards. You know, I'm into the food thingy. So.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Last year, in the height of the pandemic and all the community spread, I was scheduled to have a major procedure. The hospital needed pre-approval from your health insurance. I expected to have a lot of delays due to everything that was happening at the time. However, BAF was able to get my response in within a couple of days. This year, unfortunately, that procedure led me to have some complications, and I was scheduled to have another emergency surgery. That was on the weekend. The hospital mentioned that they did not have an emergency contact for BAF, so I would need to try and wait or pay for it out of pocket. However, I did have Mike's phone number. I was able to phone him on a Saturday morning. He was able to reach the person that handles the emergency line, and I was able to have my approval sent within the hour and have everything done and settled. Very thankful for BAF for their quick and speedy response despite the pandemic and the office closures and the work from home and all the other difficulties that we've all been facing in the last 2 years. Thank you, BAF.
BAF, that's BAF for life.
Well, that's it for today, folks. I hope you've enjoyed the show, and we'll be right here again next week, Wednesday. But until then, I'm Desiree and
I'm Chuck Taylor. Thank you for tuning in to Your Health, Your Wealth, brought to you by BAF Insurance.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.